evening to
We are
all the
live.
viewers of this. A very good evening to all the viewers of this podcast. My greetings to my respected President, Dr. Sunita Tandulwadkar, Madam. My great regards for her and a hearty welcome to our guest of honor today, Professor Dr. Sudhir Bhave. This podcast series we call it Gyan Pravah. ज्ञान का बहता अनोखा एक रंग हर रात 8 बजे आप जुड़िए फॉक्सी के संग. This is a very successful idea of my beloved President, Dr. Sunita Madam. And today we are telecasting episode number 141. This idea has been conceived and is a brainchild of Sunita Madam, who is a gracious epitome of dedication, determination, discipline, and multitasking. There is so much to learn from you, Madam. Only 5 months into her leadership and more than CMEs and workshops being conducted at various more than 300 societies of FOGSI, more than 30 publications, so many public awareness programs, blending beautiful spirituality and creating a massive public awareness wave, joining the societies from Kashmir to Kanyakumari and meeting the presidents and secretaries of all the nooks and corners of India and listening to their problems. Madam, your work is phenomenal and we all are in awe of you. There is so much to learn from you and it's a great honor for me that I am in your team. Today we are dealing... Yes, ma'am. So we are talking about coping strategies of stress and anxiety with Professor Dr. Sudhir Bhave sir. And on this occasion, I would like to know, we would like to listen from you, ma'am.
Thank you so much, Rashmi. Thank you for your kind words. And Dr. Sudhir Bhave, namaskar. Thank you for coming on a FOGSI platform. It's a great honor for all of us. And the topic which you are going to talk on, anxiety and stress, I think it's not only the FOGSI and even the common people will hear because it's free on YouTube and many more will be benefited with this podcast. That's the beauty of the podcast. I felt like all the chairperson, I'm helping them and showing them how the leader can be, how can they take an interview, how they can have a dialogue with someone in an open platform. But believe me, Dr. Bhave, in 140 faculty meeting every day to me, I think I have evolved. There is so much to learn from each and every one. We are taking academic and non-academic, from social, philosophical, spiritual, political. So many people have come here and there is a lot to learn. So this Pravah series of our podcast, I don't know about the chairperson, but it has benefited me hugely. It has evolved me as a person. So thank you. And thank you, Rashmi, for getting Dr. Sudhir Bhave and having the subject which is of need of it today. We have anxiety every day. Even while climbing the flight, now we are anxious. So it is so important. And I know I may be taking off, but I'll be definitely listening to this tomorrow. And sir, thank you once again for coming on FOGSI platform. Thank you.
My pleasure. Thank you.
Thank you, ma'am. My salute to your commitment. And I must again say, ma'am, there is so much to learn from you. My great regards and pranam to you. And thank you very much for joining today.
I would like to hear his biodata, the CV which you are going to tell. Till they say stop the phone, I'm here with you all.
Yes, ma'am. Thank you, ma'am. So I would like to introduce Professor Dr. Sudhir Bhave to the podcast today. Sir is a psychiatrist, very well known and renowned. He has completed his education from Postgraduate Institute of Medical Sciences and Research Institute, Chandigarh. Is professor and head of the Department of Psychiatry, NKP Salve Institute of Medical Sciences, Nagpur. He is a very beloved teacher with more than 37 years of experience in teaching. He has created students, carved their minds and hearts with great perfection. He is a very doting father to two lovely daughters and a very good singer. He has also created an album. To his credit are many awards like Nagpur Bhushan Award, Lifetime Achievement Award, and he is also winner of LP Shah Oration Award of the Best Show. He is the chairman of Cultural Subcommittee of Indian Psychiatric Society. Apart from numerous papers in Index Journal, there is one book he has edited, and it is worth mentioning, and it is about cyber psychiatry. So, given me one more chance, I would like to have one more episode with Dr. Professor Sudhir Bhave sir, talking only about cyber crimes and cyber psychiatry. So, and this book is a very is a sort of book which can guide in today's situations. We have to deal with various cyber crimes and side effects due to overindulgence in internet. So, with this introduction, I would like to welcome Professor Bhave sir. Welcome, sir, to this podcast.
Thank you so much. Thanks for having me here. Thank you.
Thank you. Thank you. Bye-bye.
Bye.
Bye.
Thank you so much. So, sir, I remember one Hippocrates saying, he says that healing is a matter of opportunities. Healing is a matter of time. But more than that, healing is a matter of opportunities. Those opportunities, especially created by few of us doctors who treat the patients beyond medicine, have their healing touch. You are among one of those healing doctors. And it's a great honor to have you today on this platform.
Thank
We
you.
have generally been listening to various things nowadays, like there is one mishap of a accident or etc. And the frequent flyer says that he or she is having anxiety to board the flight. We also listen to a mother who comes with her teenager son or daughter and says, so she has so much stress because he's going certain type of competitive exams. We also listen to a teenager or a young person or even a young medical student who is undergoing a viva. He says, I have anxiety. And we also nowadays quite frequently listen that I need help. This is nowadays, this is something very much in vogue. And these are the two very frequently heard terms, stress and anxiety. So I would like to know, sir, what is the difference between the stress and anxiety?
Yeah, these two terms are used fairly commonly and very often interchangeably. Like people would say that मैं बहुत anxious feel कर रहा हूँ or I'm quite stressed, even though they are not exactly same. I mean, if you look at it technically. For example, stress basically indicates a response to an external challenge, right? For example, if somebody tells me that in the next half an hour you have to reach this thing to my friend, so please could you do this? It's a stress for me because that's a challenge that I have to meet. Now, my response need not necessarily be negative. I mean, I'll take it as okay, I have to reach this, but it's a stress because it needs some readjustment on my part with regard to my physical resources, my psychological resources, and so on. So it's basically response to a challenge, whereas anxiety is associated with a feeling of unease, excessive worry in response to maybe something undesirable happening in the future. So anxiety has a more negative quality to it than, say, stress. So stress is okay. Stress is a part of everyday life. I mean, that happens to all of us every single day, multiple times. But anxiety is something that, I mean, we would like to stay away from. I mean, it's not very desirable to feel anxious. Yeah.
So where does this root of anxiety lie, sir? Does it lie in our childhood? Is it related to the upbringing? What would you like to say about it?
Yeah, that's an important question. I mean, the root of anxiety lies basically in two, three things. One is the genes itself. Like children inherit neurotic tendencies from the parents. Like if the father has something like an anxiety disorder, or maybe he's very obsessive, or maybe he responds to stress in a very negative way. then that's a kind of tendency that could be inherited genetically. Secondly, I think as you hinted, early childhood experiences are very important. For example, having a parent who is himself or herself very anxious, I mean, that creates a negative role model, a wrong kind of role model. If I love my father and my father is somebody who is very easily anxious, very anxiety prone, then I tend to introject those qualities in myself and I also become an anxious person. Or secondly, if the parents are too punitive, punishing, I mean, my father is very harsh. He keeps on labeling me, keeps on abusing me physically, verbally, keeps on telling me that I'm good for nothing. Now, that leads to my becoming an insecure child, and I get anxious at the drop of a hat over every small thing. So, these kind of childhood experiences, they matter. And thirdly, even the current life circumstances. I mean, a person could be relatively healthy, but if the current life circumstances are quite difficult, I mean, that can lead to anxiety. I would say that all of us have got a breaking point. I mean, anxiety is not restricted to our patients of anxiety disorder, but all of us have got a breaking point, and we lie somewhere along the spectrum. For some of us, the breaking point could be very high. I mean, for example, it might take a very high degree of stress for you to break down, whereas I might break down at a lower level of stress. So basically, these three are the factors that lead to anxiety.
And do we often see this uh, episode of anxiety getting chronic in this spectrum of anxiety disorders?
Sure, it can. I mean, anxiety in the most acute form, anxiety is called a panic attack. Like somebody has a panic attack, which means the person gets extremely anxious. I mean, the anxiety is so severe that it gives rise to what we call as a feeling of impending doom. अब तो मैं मरने वाला हूँ, अब बस मुझे हार्ट अटैक आने वाला है, मैं तो गया, अब मैं कोलैप्स हो जाऊंगा. I mean, it's so bad. But it's very short lasting. It would last for 5 minutes, 10 minutes, 15 minutes. So that's the most acute form. And then there is a variation in the duration. And as you said, there are longer forms of chronic anxiety. People who are quite anxiety prone, I mean, they can come to us with some symptom like डॉक्टर साहब पिछले 10 साल से मेरे को बहुत घबराहट होती है, बेचैनी रहती है, ठीक ही नहीं हो पा रहा हूँ. So it can go on for years and years.
Yes, sir. And stress and what are the causes of stress? What causes stress? We have talked about anxiety. So I would like to know what
Yeah.
are the causes of stress, sir?
Yeah, I think here I would like to differentiate two things. One is the sources of stress. Sources of stress can be very large number of things. I mean, I often say jokingly that everything under the sun, including the sun itself, can cause anxiety. So there can be so many sources. I mean, sources could be environmental. I mean, a very noisy area, a lot of air pollution, okay, loud sounds of the machinery that can lead to anxiety. Interpersonal anxiety, like you have a boss who is not very considerate, you have colleagues who are critical of you and not very cooperative, okay, or you have a parent who is very harsh. So it's interpersonal. Anxiety can be work related, like very strict timelines, a huge amount of work to be done. Now we are doctors, so I mean, talking of doctors, the source of stress can be, I mean, too few patients come to see me, or on the other hand, too large a number of patients come to see me, and I don't know how I'm going to see them, or maybe you getting a bad name because of some case that went wrong. Okay, so I mean, sources are too many, but as I said, I would like to differentiate between two things: sources and cause. Sources can be multiple, but cause is one. And the cause is, now this is very important, the cause is the way we look at the source of stress. I mean, do I look at the source of stress negatively with irrational thoughts, pessimistically, or do I look at it in a lighter vein, optimistically? I just give a small example, a very interesting example. I mean, one day a patient came to me, she was very depressed. And she told me that I'm डॉक्टर साहब आज मुझे बहुत उदास लग रहा है. तो मैंने कहा क्यों? तो वो कहती है कि डॉक्टर साहब आज मेरे हस्बैंड ने ऑफिस जाते समय मुझे टाटा नहीं किया. एंड शी वाज वेरी सैड. सो आई टोल्ड हर कि और भी रीजंस हो सकते हैं टाटा ने किया, तो शी इज नहीं नहीं नहीं, मैं जानती हूँ, हम हमारे बीच का प्यार खत्म हो गया है एंड सो ऑन. सो आई सेड आई एम गोइंग आउट ऑफ द रूम, यू टेक दिस पेपर एंड पेन एंड राइट डाउन ऑल द रीजंस which are, I mean, likely, probable, because of which he didn't do Tata. And when I came back, she was already smiling. And when I looked at the reason, they were something like, कि हो सकता है वो बहुत जल्दी में होंगे, इसलिए टाटा करना भूल गए, या कल उनको ऑफिस से डांट पड़ी थी क्योंकि लेट हुए थे, इसलिए आज जल्दबाजी में भाग गए. So, I mean, in that short span of 5 minutes, she could see that it was the Tata not happening versus she thinking कि अब मुझसे प्यार नहीं करते हैं. So
Yes.
basically, more important than the event, it is the way you look at it. There was a Greek philosopher by the name Epictetus. I mean, he lived sometime in the 3rd century BC. And he said something wonderful, that events don't disturb you. It is your perception of the event that disturbs you. Just think about that. Events don't disturb you. It's your perception of the event that disturbs you. So I think there's a big lesson in this for all of us. I mean, whenever we complain about something going wrong or somebody not behaving properly with us or something being too challenging, something being too overwhelming, I think all of us need to ask ourselves कि क्या मैं ही उस चीज को कुछ गलत नजरिए से देख रहा हूं. आई मीन, मैं अपना नजरिया कैसे बदलूं जिससे कि जो कि ज्यादा रैशनल. And I mean, that can change things significantly. So, how you look at it, I mean, I would say that's the cause of stress.
Absolutely, sir. So very well explained, sir. So in a layman's language, um, sometimes we used to say that stress can be beneficial also. I mean,
Yeah,
it can be productive also. So is it true?
it's very true. See, I mean, in psychology, there is something called Yerkes-Dodson law. I mean, not getting too technical, but the law says that, I mean, if you plot a graph between stress and output, as the stress increases, the output increases. एग्जाम गोइंग स्टूडेंट स्ट्रेस में है, इसलिए पढ़ाई करेगा, इसलिए मेहनत करेगा, आउटपुट बेटर होगी. बट इफ द स्ट्रेस बिकम्स टू मच, अगर आगे बढ़ती रही, देन द आउटपुट स्टार्ट्स कमिंग डाउन, द ग्राफ कम्स डाउन. So some stress improves performance, but stress beyond the point, it lowers the performance. So some stress is very important. I mean, if you say कि मैं तो हंसता ही रहता हूँ हमेशा, मैं कभी टेंशन नहीं लेता हूँ. Now, even that's not good in some ways. I mean, you could be underperforming.
So is this something related to, correct me if I'm wrong, sir, coping strategy, coping mechanism, or coping capacities? Is it related to this?
Coping strategy, yeah. I mean, going back to the first thing about the causes of stress, I mean, a very important coping strategy could be, I mean, trying to change one's own thoughts. Like if I'm getting anxious about something, if I'm getting stressed, I change my own thought pattern. I change this automatic thought that's coming in my head, and that can become a very, very important coping strategy. In fact, when we teach patients a coping strategy in any mental health profession, whether it's a psychiatrist like me or a psychologist or a psychotherapist, I mean, one very important therapy that we give to many people is trying to change the thought pattern. We try to make the person understand as to, I mean, why is he reacting in this way? It's his own thinking. What kind of thoughts are leading to anxiety? And I mean, how can he or she change their own thoughts? So that I would say is the primary coping mechanism for most of us.
And what can be the most important strategies to manage stress? So I think most of the viewers will be in need of answer to these questions, sir.
Like I said, the most important strategy is looking at your own thoughts, changing your own thoughts. I'll just give you an example. I mean, this is a confession that every single day, I mean, in the evening, I just imagine that what were the times of the day when I was not in a good mood. Maybe I was irritated, or maybe I was anxious. And I just recall that event, and I try to remember the thought that went through my head. Okay. I write down that thought and I try to examine that thought, that is this thought correct completely, or there's something wrong with it. And I can tell you that almost every single time I can find that there is some flaw in my thought. Like, for example, I think in my biodata you have read that I'm the president of the West Zone of the National Society, which is Maharashtra, Gujarat, and Goa. So, I mean, as the president of this western part of the country, I mean, there are many challenges frequently. And I tell myself, oh my God, now this seems to be very difficult. I don't know if I can do this. And that makes me anxious, concerned. So I write this down, and when I examine my thought, oh my God, I mean, how will this thing happen? Then I can find that there is a flaw there because I have met similar challenges in the past. I have met them successfully. So I need to convert this sentence that, oh my God, now I need to take out this, oh my God. Because when I say, oh my God, I mean, I'm already setting the stage for getting anxious. So,
Yes.
I mean, we call this self-talk. We need to be conscious about our own self-talk. What's the kind of negative thing we are feeding ourselves? And then I could tell myself that it is a challenge, but I mean, this can be overcome. So, I mean, this I would say is the most important strategy. There are many others, but this I think is the primary one, at least for me and many others like me.
So journaling or self-talking or self-assessment, this is something you want to say, sir. It can be very helpful in identifying and
Yeah, very
managing
good.
stress.
Yeah.
Yes. So, sir, nowadays we are seeing this scenario because we have this internet and media, and just completely compromise the quality of sleep. And
Mm, mm,
most of the time is spent, most of the people have screen addictions. And this blue light has
mm.
hampered the sleep hygiene of most of the people. Does this has any role in stress, sir? Uh, Sleep hygiene, or
Yeah,
what's the
definitely. I mean,
sleep and stress reduction?
yeah, I would like to say that sleep is a highly underestimated gift of nature,
Yes,
highly
absolutely.
underestimated, undervalued gift of the nature. Now, people generally see sleep as a resting phase when you take rest and then, okay, you're ready for the next day. But the sleep is much, much more than that. I mean, the doctors would know that sleep has basically two kinds of phases like REM sleep, NREM sleep, and multiple phases in between. And each of these phases of sleep is responsible for very important functions of the mind and the body. Like, for example, sleep is responsible for improving your memory, consolidating your memories. I mean, your short-term memories are they go in the long-term memory. You remember them for a long, long time to come. Sleep is important for your immune function. It's important for your metabolic functions, endocrine functions, muscle generation, and so on. A very large number of, benefits accrue from sleep. But these days, as you rightly said, the sleep has got badly compromised. I mean, I often say jokingly, only half jokingly, that the sleep of the world went for a toss in 1895 when Thomas Alva Edison invented the electric bulb. I mean, with the invention of bulb, artificial light came. I mean, humanity started sleeping much late because of the late evening light. And I mean, for the past 2.5 decades, things have gone down the drain because of the that wonder device called smartphone. You rightly pointed out that the blue light that comes from the smartphone, it delays sleep. I mean, sleep is initiated by a hormone called melatonin in the brain. I think all doctors know this. This pineal gland at the center of the head, it secretes melatonin, a hormone that initiates the sleep processes in the brain. Now, for a person who is watching smart screen before going to bed, which is something which is extremely common. I mean, in one survey I did, about 70 to 80% people, they reported that they will look at their mobile phones, browse the mobile phone just before going to bed. So, I mean, this blue light, it contains LED lighting, and LED throws a blue light which falls towards the blue end of the visible part of the electromagnetic spectrum. So, this blue light suppresses melatonin by roughly 2 hours. So, just imagine, like, if my head wants to sleep by 10 p.m., if I watch a screen before that, it could be any screen, even television, laptop, tablet, cell phone, anything, even TV. I mean, so many people watch TV before going to bed. So that's going to postpone my sleep from 10 p.m. to 12 p.m. And I mean, you can imagine. I mean, I should be sleeping for 8 hours, but I'm able to sleep for only six because I watched the screen at bedtime, and that causes a lot of difficulty. Now, uh, एक तो नींद कम हो रही है, and secondly, the smartphone itself. I mean, the devices themselves can become a reason for anxiety. I mean, we know that people very commonly use social media, and then we are too much focused on the likes and dislikes, and our self-esteem gets paired to it. So, youngster who, I mean, watches social media and sees social media as a source of approving oneself.
Getting acknowledged,
Yeah, getting acknowledged, getting appreciated, getting approved.
validation,
Now,
validation.
that
Yes.
gives to anxiety. People reading a lot of news, some true, some fake on the cell phone can lead to anxiety. I mean, there's so much of false propaganda all over the internet that can cause anxiety. People who browse the internet I mean, check on their own health. Like, I have a headache, I keep on searching, and the screen tells me that, oh, brain tumor could be a cause of it. So, something that we call cyberchondria, like hypochondriasis. So that can lead to anxiety. So screen use, I mean, apart from delaying sleep, the screen use itself can become a source of anxiety.
And the cyber addiction or internet addiction is also causing psychiatric changes, and completely hampered. This sleep deprivation has completely hampered the hormonal orchestra in our bodies, to say it. So in older times, they used to say like after 3 hours after sunset, it's an ideal time for sleeping. So maybe due to our changed lifestyles, it may not be possible. But even if the generation of this time thinks that they will sleep, watch up to 1 hour of media or internet, they won't stop at 1 hour. It will go prolonging for up to 12, then 1 a.m., 2 a.m., and the cycle continues.
True.
So that is this kind of addiction. It's happening in this generation. And I think so we need to do massive public awareness work regarding this. So
I'll also tell you one thing, that people, almost everybody, I mean, we grossly underestimate the time for which we are using screens.
absolutely.
I mean, you ask anybody. I mean, you ask your life partner, your spouse, कि दिन में कितने घंटे देखती हो, and she would say 1-1.5 घंटा. Now, when you observe the device, I mean, switch the right buttons, you'll find that she's watching it for 3 hours. I mean, we tend to believe that we are using it less, but I mean, if all of us do this exercise, like tomorrow evening, if we just check how much we are using, I mean, most of us would be shocked that, oh my God, am I using it so much? Yeah.
And because this is completely disrupting the hormonal orchestra, it is also definitely a cause of resultant stress in our lives, no doubt about it.
Yeah.
And you very correctly said, sir, we are taking it lightly. We are taking it, we are not giving due importance to the sleep hygiene, actually.
Yeah.
So sleep is one of the factor. And is there any role of exercise also in reducing stress?
Exercise is very important. In fact, I tell almost all my patients to exercise every day in the morning. See, exercise gives three kinds of benefit. I mean, physical, we all know. I mean, muscle building and making bones stronger, and cardiorespiratory, I mean, the health of the heart and the lungs. That's physical. Second is improvement in the brain function. Exercise is known to improve intellectual functions like our ability to concentrate, our ability to remember things, our ability to organize our knowledge. Like, for example, an exam going student, I mean, he needs to organize the knowledge. He needs to organize the answer that he wants to give. And thirdly, our emotional life. In fact, people who exercise regularly in the morning, they will find that they are able to handle feel low feelings or feelings of stress or anxiety much more effectively. So physical, intellectual, and emotional. I mean, all three kinds of health, they improve with exercise. In fact, there are good scientific studies that tell us that daily morning exercise is a very good treatment for depression, which can be mild or mild to moderate depression. I mean, exercise alone can combat that. And I tell my patients, I mean, so many of my patients, I ask them कि exercise करते हैं क्या? जी हाँ करता हूँ. कब करते हैं? शाम को करता हूँ. So I tell them कि शाम को मत करो, मॉर्निंग में किया करो. Because the intellectual and emotional benefits, I mean, they would be persistent through most of the day if you exercise in the morning. But if you do at night or late evening, उसके बाद सोना ही है. I mean, केवल रात को मूड अच्छा हो गया तो उससे बहुत फायदा नहीं होने वाला. So I mean, these benefits can come only in the morning. And I mean, it's always good to have a feeling of well-being and feeling of having started your day well with something healthy. So morning exercise is very important.
Yes, sir. And what would you like to say about meditation, sir? So nowadays we really say that meditation is also going to help us in stress management. What is your take on this?
Meditation is an excellent tool. I mean, I can't praise it enough. I mean, I would say that other therapies and psychotherapy, वगैरह, I mean, they do help a person, but they help at a more superficial level. Whereas meditation, मैं अक्सर कहता हूँ कि meditation is like overhauling the person, अंदर से. I mean, something that can bring about real deep down changes in you, in your personality, is meditation. And the meditators often experience a feeling of calm, peace. I mean, they are often unperturbed in situations which are rather difficult for most people to handle. So, I mean, if a person can meditate every single day, 2 times a day, I often prescribe meditation to many people, that 20 minutes in the morning, 20 minutes in the evening. I mean, that's a wonderful tool. I've seen people improve rapidly with only meditation, not only in psychological difficulties, but even physical problems. I mean, there are many miracle stories that I personally know of where even physical illnesses have melted down in a person who meditates regularly. So, yeah, it does help significantly.
So would you like to share any story regarding the same?
Yeah, I mean, there are quite a few. I mean, it's almost unbelievable. I have a friend in Mumbai, I mean, no harm taking name, Dr. Manoj Bhatavdekar. He's a psychiatrist in Mumbai, a very famous one. And no harm telling a story because he has written a book on that, on his whole experience. He had a very severe rheumatoid arthritis. Okay. And extremely severe. And he was so bad that he said, I mean, in the later stages of my illness, I had to be in the bed all the time. Then one day he went to a meditation camp of a particular guru. He started meditating. And he told me, and he's mentioned in the book also, that on the very second day, he forgot to take his painkillers, but didn't realize that he had forgotten. I mean, the pain was significantly less on the very second day of meditation. And it's almost unbelievable that by the end of 6 months of 2 hours a day meditation, I mean, 2 hours is not easy. I mean, taking out 2 hours, 1 hour morning, 1 hour evening is difficult. But he has written down that with 2 hours of meditation per day for 6 months, the rheumatoid arthritis disappeared. Now, that's a miracle. I mean, this is, I think, almost unknown in the medical world, that somebody's rheumatoid arthritis and autoimmune illness, which has simply no cure in modern medicine or perhaps in any kind of treatment line. I mean, that simply disappeared. Now, these are extreme examples, but miracles of this kind do happen. I mean, I know of people like this, Dr. Bhatavdekar, who have undergone these miracles themselves with meditation. So, I mean, I will very strongly recommend it to every single person. I do it every day.
So is this self-meditation or a guided meditation, or do we need help of somebody who is guiding us through this meditation, sir?
It could be either of them. I think for the beginners, guided meditation is better. Because getting into the technique and perfecting it on one's own could be difficult. I mean, it's something like yogasan. I mean, we often say कि योगासन अगर शुरू करना है तो किसी एक्सपर्ट या गुरु के गाइडेंस में करो. घर बैठ के केवल टीवी पे देख के आप कर रहे हैं, so I mean, you could be going wrong. It's something like that. So initially guided ones are good. I mean, there are too many. There's a very huge choice. We also have many apps these days on cell phones which have guided meditation. But once you get a hang of it, then you don't need that guided part. You remember the steps to be taken, you go on doing it. So it depends on whether you are a beginner or you have been practicing it for some time.
So, sir, with your so much of practice and exposure to patients, what do you think? So, are there any other methods or tips so that we can deal with this stress apart
Yeah,
from the sleep hygiene and journaling, meditation, yoga, exercise?
yeah.
What are the other things that play a role?
There are many other ways. I'll tell you one thing that sometimes inspirational statements help quite a lot. Specific ideas, single idea, or inspirational statements. I'll give you some examples of the ones that I often tell my patients. I often tell them that whenever you have an anxiety-provoking task or a very challenging task, think of only one step at a time approach. One step at a time approach. And this never fails. I mean, पेशेंट्स कम टू मी कंप्लेनिंग कि डॉक्टर साहब बहुत टेंशन है। किस बात का? डॉक्टर साहब बेटी की शादी है, पता नहीं कैसे होगा, 4 महीने बाद है, या डॉक्टर साहब घर बांध रहा हूं, वगैरह वगैरह, एनी काइंड ऑफ स्ट्रेस। एंड आई टेल देम दैट फोकस ओनली ऑन द नेक्स्ट स्टेप, आगे देखो मत। वंस यू हैव डन द प्लानिंग कि कार्ड कब तक छपना है, लोगों को बांटने, कब घूमना है, ठीक है, कपड़े खरीदने बंबई कब जाना है, वंस यू हैव डन द प्लानिंग, देन थिंक ऑफ ओनली द नेक्स्ट स्टेप। सिंगल स्टेप्स आर नेवर डिफिकल्ट, नेवर डिफिकल्ट। मेरे बेटी की अगर शादी है तो पहला कदम होगा शायद कि मैं हॉल बुक करूं। अब हॉल बुक करने के लिए स्टेप क्या है? मैं गाड़ी में बैठूं, गाड़ी ले जाऊं हॉल तक, नॉट डिफिकल्ट। वहां के मैनेजर से बात करूं, अगली स्टेप, नॉट डिफिकल्ट। फिक्स अप अ डेट, डिस्कस विद माय वाइफ, नॉट डिफिकल्ट। सो सिंगल स्टेप्स आर नेवर डिफिकल्ट। व्हेन वी थिंक ऑफ द होल थिंग एट वन गो, बेटी की शादी, घर बांधना है, एग्जाम में क्या होगा, then we get flustered. So think of only one step at a time. A second idea that really impressed me, and in fact, I use it for myself, is something that I call a 10-year rule. A 10-year rule means that, just imagine कि अभी मैं जो टेंशन फेस कर रहा हूं, तो आज से 10 साल के बाद भी क्या ये टेंशन रहने वाला है? आज से 10 साल बाद, 20 साल बाद? एंड ऑलमोस्ट ऑलवेज द आंसर इज नहीं। कोई मुझे बड़ी इंपॉर्टेंट मीटिंग चेयर करनी है, मेरे एडवर्सरीज भी उस मीटिंग में हैं, वो मीटिंग को पुट डाउन, देयर विल ट्राई टू शो मी डाउन। ठीक है, स्ट्रेस है, बट देन आई आस्क माय सेल्फ कि आज से 10 साल बाद ही मैटर करने वाला है क्या? द इजी आंसर इज बिल्कुल नहीं करेगा। सो देयर इज इंपॉर्टेंट आइडिया हियर फॉर अस दैट ट्राई टू लुक एट थिंग्स इन पर्सपेक्टिव. Like in my 80, 90 years of life, how much is this incident going to be important? And I think an answer almost invariably is that it's not going to be important. I'll give you a small example of another interesting idea. I'm in a habit of collecting these thought for the day. The good ones. If I read somewhere कि thought for the day नेट पे मिलता है, या कई बार सड़क के किनारे पोस्टर्स मिलते हैं, I see from my car and there is somebody selling posters जिस पे एक आधा इंस्पिरेशनल थॉट लिखा रहता है. So once, in Bombay hospital.
म्हणजे शाळेत आपण सुविचार बोर्डवरती.
आजचा सुविचार. So once I was getting investigated for I have diabetes and I have diabetic peripheral neuropathy. So for neuropathy, my nerve conduction studies were being done. I was recumbent on the bed and सामने एक बोर्ड लगा था, thought for the day. And the thought was, never presume anything. That's all. 3 words. Never presume anything. So at that time I thought कि that's a very mundane thing. ये भी क्या thought है? मजा नहीं आया. Never presume anything. But slowly I started realizing, as I started observing more, that it's a great thought. Very frequently we think कि गड़बड़ होने वाला है, मैं कर नहीं पाऊंगा, वो पता नहीं कैसे रिएक्ट करेगा. And I would place it at 90 to 95%. 95% our presumptions are wrong. So I often keep on reminding myself, don't presume. Why do you presume that things are going to get wrong? Why do you presume that the meeting that you're going to chair is going to create difficulties? So I think that's one very important way to combat your own anxiety. Don't presume anything. One statement that I often use with my patients, an English statement. When the patient says, "Doctor साहब ये हो गया तो बड़ी मुश्किल हो जाएगी, पता नहीं क्या करूंगा," I tell them that if this happens, the heavens are not going to fall down. Just think about it. The heavens are not going to fall down. यानी जिंदगी में प्रलय आ गया और सब कुछ डूब गया, ऐसा नहीं होने वाला। We have a tendency, I mean, most of us have a tendency to magnify our the source of our stress.
Overthinking can be said.
Thinking negatively, magnifying it. घर में बच्चे के हाथ से प्लेट गिर के फूट गई, बच्चे को बहुत मार पड़ती मम्मी से, ठीक है। नाउ हियर शी इज मैग्नीफाइंग इट। अब 15 प्लेट्स थी, एक गलती से गिर गई, फूट गई। आई मीन द हेवंस आर नॉट गोइंग टू फॉल डाउन। आई मीन दिस हैपेंस ऑल द टाइम। तुम्हारे हाथ से भी प्लेट फूटी होंगी, है ना। सो आई थिंक दिस मेनी मेनी पेशेंट्स गिव मी अ फीडबैक, डॉक्टर साहब आपका वो सेंटेंस बहुत काम कर गया कि द हेवंस आर नॉट नॉट गोइंग टू फॉल डाउन। So I mean, these are the kind of thoughts that really help. So yeah, I mean, talking of inspirational statements and individual attitudes, I think these things really help. One thing that I would also like to add is learning to say no.
Oh,
Learning
yes,
to say no,
that
because
is very important and very difficult at the same time.
very difficult. I mean, many of us are in this habit. I mean, we are submissive, passive. किसी ने काम बता दिया, अब उसको नहीं कैसे बोलूं, हाँ कर दिया। दोस्त ने बोला यार पैसे चाहिए, 1 लाख रुपए चाहिए, अब नहीं कैसे बोलूं, हाँ बोल दिया। एंड देन एट लेजर वी कीप ऑन वरिंग अबाउट इट कि यार मैंने नहीं बोलना चाहिए था, मैंने क्यों किया, मैंने ऐसा नहीं करना चाहिए था। सो आई थिंक इट्स वेरी इंपॉर्टेंट दैट वी ऑल ऑफ अस शुड लर्न टू बी assertive, to speak our mind out without getting aggressive, शांति से, but speaking out your feelings and learning to say no. कि यार I'm sorry, I understand, but I cannot do this for my own reasons. And I've also seen that people who can say no, people who are forthright, they are always more at peace. I mean, they have only those amount of things on their plate that they can comfortably handle. Otherwise, I mean, we also see people who get inundated with too many tasks just because they can't say no, and बाद में they keep on complaining कि यार बहुत काम है, इसने ये काम दे दिया, उसने वो काम दे दिया. So even that's an important strategy for stress reduction.
That's a very important point, sir. And role of hobbies, sir. Anything we would like to do, like extracurricular. I mean, any hobby. How does it help in management of stress?
Hobbies are very important. See, I mean, if we look at if I'm awake for 18 hours, now in that 18-hour period, I mean, my mood graph goes up and down. I could be stressed, say, 5 times, 7 times, 10 times. Okay. Most of the time, I'm preoccupied with something. I'm either worrying about the future or I'm regretting about the past. But I mean, if you foster a hobby, if you nurture a hobby, आई टेल माई पेशेंट्स कि कम से कम आधा घंटा रोज ऐसा कुछ करें जिसमें आपको केवल आनंद आ रहा है, केवल आनंद आने के लिए करो, यानी नॉट एज रिस्पॉन्सिबिलिटी और ड्यूटी और समथिंग दैट यू प्रॉमिस टू समबडी, बट केवल मजा लेने के लिए। आई मीन मेनी पेशेंट्स टेल मी, आई मीन दैट्स अ कॉमन कंसर्न कि डॉक्टर साहब मेरे तो कोई हॉबी है नहीं। माई आंसर टू दैट इज कि आप इमेजिन करो कि स्कूल में आप किस चीज में अच्छे थे, स्कूल में किस चीज में अच्छे थे। नाउ पीपल कैन रिमेंबर दोज काइंड ऑफ थिंग्स कि हाँ मैं क्राफ्ट में अच्छा था, मेरे को क्राफ्ट में अच्छे मार्क मिलते थे, या गाते समय मेरे को म्यूजिक टीचर फ्रंट रो में खड़ा करती थी हमारे ग्रुप सॉन्ग में, या फिर मैंने ड्रामा में पार्ट लिया था, या मैं टेबल टेनिस अच्छा खेलता था। समथिंग, आई मीन समथिंग क्रॉप्स अप इन मोस्ट पीपल, आई मीन नॉट एवरीबडी, बट फॉर मोस्ट पीपल देयर इज सम सच थिंग. So I tell them that pick that up. I mean, foster that. I mean, there are so many things, so many of our hobbies get very unfortunately, they get left behind in the humdrum of our stressful life. I mean, if I think of myself, I was very good at sketching. I was very good. Now, about my singing, you told, I continue to nurture my singing, but I was very good at sketching things. I was very good at painting. But then, unfortunately, I mean, my medical
You're a
stream,
very good singer also, sir.
yeah, I do sing, which I'm unfortunately still continuing. But then, I mean, drawing is something that I left behind. And that's sad. I mean, maybe I didn't take adequate efforts. So, I mean, that's the kind of thing what we need to go back to. Because that half an hour that I spend every single day, I mean, that's a pure time of pure pleasure, nothing else. I mean, no दिमाग में भूतकाल की regret है, न भविष्य की चिंता है. I'm just enjoying something. Family life. I mean, trying to nurture a happy family. I mean, I would place that extremely high. Family acts as a huge buffer for your stresses. अब घर में अगर एज ए रिस्पॉन्सिबल पर्सन, एज ए वाइज पर्सन, अगर आप घर का माहौल ऐसा बनाने में हेल्प करते हैं जहां खुशहाली है, स्माइल्स हैं, लाफ्टर है, आई मीन पति पत्नी के बीच रोमांस है, बच्चों के साथ चाइल्ड लाइक प्ले है, आई मीन दैट्स अ काइंड ऑफ प्लेस दैट कैन टेक अवे योर स्ट्रेस वेरी सिग्निफिकेंटली। अब
और
हम
अगर टाइम थोड़ा बहुत कम है तो इंटेंसिटी है मिलने में, बच्चों के साथ टाइम स्पेंड करने में
टाइम भले ही
तो
बहुत कम, मेरे एक टीचर ने मुझे, मैंने उनसे ऐसी कहा, सर ने कहा कि सर तुम हॉबी क्यों नहीं नर्चर करते हो, तुम अच्छा गाते हो। सो आई सेड सर टाइम नहीं मिलता है। सो ही सेड समथिंग वेरी गुड। ही सेड सुधीर, टाइम मिलता नहीं है, निकालना पड़ता है। एंड आई थिंक दैट्स वेरी गुड। आई मीन हॉबी नर्चर करने के लिए या फैमिली के साथ एंजॉय करने के लिए टाइम मिलेगा नहीं, निकालना पड़ेगा। अगर आप कह रहे हो, पत्नी कंप्लेंट करी कि मेरे साथ बैठते नहीं है, बातें नहीं करते हैं, और अगर आप कहते हो नहीं बहुत बिजी हूँ, बहुत बिजी हूँ, बहुत बिजी हूँ, यू आर लाइंग। आई मीन इफ यू डिसाइड, यू कैन सर्टनली टेक 10 मिनट्स आउट, 5 मिनट्स आउट। आप पत्नी के साथ हंसी खुशी, रोमांटिकली वो 10 मिनट कैसे भी रह सकते हैं, वो 10 मिनट निकालना बिल्कुल मुश्किल नहीं। सो आई थिंक इट ऑल डिपेंड्स ऑन योर मोटिवेशन। तो टाइम निकालना बहुत ही इंपॉर्टेंट है।
So these are all important strategies to deal with the stress. But sometimes what happens that the person cannot apply all these things and
हम्म।
feel overwhelmed with stress. So what's the right time that person or the somebody who is close to him or her understand that now needs a proper guidance from a doctor, from a psychiatrist. So what are those signs or when a person should consult a doctor, psychiatrist especially?
Yeah. See, all of us have got our own coping strategies. I mean, once we cross our childhood, we become adolescents. I mean, right from adolescence, every single person has coping strategies. An adolescent might say कि मेरे को जब टेंशन आता है तो मैं मोबाइल देखने लग जाता हूँ. Somebody might say टेंशन आता है तो मैं गुनगुनाने लगता हूँ. Somebody might say कि मैं डीप ब्रीदिंग करने लगता हूँ. Somebody might say कि मैं अपने फादर को कंसल्ट करता हूँ, मदर से बात करता हूँ, दीदी से बात करता हूँ. So every single person has a coping strategy. So when people ask me कि डॉक्टर साहब हमने मेंटल हेल्थ प्रोफेशनल को कब दिखाना चाहिए, my answer is that if you have exhausted your own strategies, I mean your own internal strategies to deal with problem, or you have also talked to some wise person who you think is wise. I mean somebody who can help you, could be a parent, could be a friend, could be any uncle, aunt, maybe your neighbor. So if you talk to that person and no help is available, and you think that the stress is occurring reasonably intensely and very frequently, then it's important to consult. आपने खुद कोशिश कर ली, आपने हेल्प भी ले ली, पहचान के लोगों से, स्ट्रेस चलती जा रही है, कम नहीं हो रही, आई थिंक देन इट्स अ टाइम. I would also like to state here that people are often quite wary or quite reserved, not very willing to go to a psychiatrist or a counselor, psychotherapist. I often say, and quite truthfully, that everybody needs psychotherapy. Everybody. I mean, I can't think of any single person जो ये कहे कि मैं परफेक्ट हूँ, मैं परफेक्टली खुश हूँ, मैं जैसा हूँ ठीक हूँ, मैं हमेशा सही सोचता हूँ, मुझे गरज नहीं है. I mean, each one of us, I mean, we have loopholes in our own psyche, our mind. We have weak areas, we have problematic areas, we tend to create difficulties for ourselves. So, talking to an expert who is external, objective, I mean, that often helps. So, I mean, nobody should be very shy or embarrassed or stigmatized about seeking psychotherapy or discussing with a psychiatrist when these kind of difficulties arise.
Yes, absolutely, sir. And we are coming towards the end of our discussion today. And
Right.
it was really so much helpful. I have noted down all the experts or the points from our conversation today.
Okay.
And I can say that what are important things is journaling, self-talk, maintaining a very good sleep hygiene. No, I'm not underestimating the value of sleep in our daily life and role of exercise, especially the morning exercise, meditation, role of hobbies, role of family support, peer support or the friend support. And more important, like do not assume or presume anything in your mind and start building theories upon that. And uh, more important, talk to or speak to or take help from an expert whenever is needed. Don't make it a taboo and go to your doctor and seek help. So would you like to add something to this as a concluding message?
Yeah. I mean, if I'm to sum up, I would like to say this that I mean, stresses are a part of life. We cannot imagine a life without stress. I mean, stresses are going to be there maybe every single day. But try to see that you manage your stress wisely by doing the kind of things that we have just elaborated upon. I mean, try to sleep well, ensure a good sleep, exercise every single morning. If possible, something like meditation or mindfulness exercises every single day. I mean, nurture a happy family. And yeah, one more thing, stay away from alcohol and drugs as far as possible because they themselves can lead to stressful situations. And lastly, and perhaps most importantly, try to look at your own self-talk, what you are telling yourself about what you are perceiving as stressful, and try to make your thoughts more rational, more optimistic, which they should be. And I mean, that's a good way to handle your own stress.
Thank you so much, sir. And given me a chance, I would definitely like to talk with you more about cyber psychiatry in one more episode, because we know your immense work in this area, and it will be a great to listen to you about this topic. So, all in all, thank you very much, sir, for joining with us and for being with us today. It was a great honor for me.
Please allow me to say that even I'm very happy. I mean, it was a great 1 hour that I spent. I mean, you asked all the right questions and elicited, I mean, things which are perhaps very important. So I'm very happy. I hope this helps people who listen to it. Thank you so much.
Thank you very much, sir. I'm especially also thankful to Dr. Sunita Tandulwadkar, madam, for giving this opportunity and support team. If you are there, thank you so much for this very well organized podcast. Thank you very much, sir.
Thank you.
And very good night and very good time.
Night to all. Thank you.
Thanks.
Thanks.